go down. Hey, what's going on? What's going on? Welcome to Smashing Kidney Disease. I am your host, Steve Belcher. Thank you for joining me tonight. How's everyone doing? Again, share this broadcast. This is going to be an awesome show tonight. We got Jen Benson from transplantjourney.org. She brought one of her mentees. His name is Remy. This is going to be a great show. So share this broadcast. If you're looking for a transplant, you're on the transplant list, or you just wanted to know something from an organization that deals with transplant and the founder and the CEO happens to be a transplant recipient, this is the show you need to be watching. And I'd like to welcome our global audience. Thank you so much for watching tonight. But before we get to Jen, I just like to say one thing. I just like to clear up something. I did a post today. There was a picture of a dialysis chair and a machine and some fast food at a, here they're called Royal Farm. They may be Wawa somewhere else where there's a store that sells chicken and packaged goods and it's a gas station. But let me just say, the picture said, eat your way to diabetes, right? And then have a seat in the machine. So look, guys, don't overthink this. If you look at the picture, right, it's that food that you see in 7-Eleven that's been sitting there 12 hours a day, like the chicken or the McWaffle burger or whatever the case, something loaded with high in sodium, ham and bacon or whatever the case, those type of sausage sandwiches, they're loaded with triglyceride, sodium, fat, everything that's a mixture of ingredients that can contribute to high blood pressure, which is the second leading cause of kidney failure, and diabetes, which is the leading cause. I know that people are born with type 1 and that not managed can lead to dialysis. I know that. These PSA messages are specifically crafted and designed to send a subliminal message. That's the only thing I can say. I went to school for this, and that's how I designed my message to get this point across for people to change their behavior, their health behavior. And I would go to the end of the earth to do that. If it's going to take to save your life, to putting a picture up with someone with gangrene or with their limbs amputated to promote about the leading cause of kidney disease, which is diabetes type 2, I'm going to do it. That's all I want to say about that. But just know these images, they've been around. I had them in my catalog for years, and that's not the beginning. I have so much content from 4 or 5 years ago when we first started that people haven't seen and don't know about, that I'm just recycling it. So that's what that's about. It's not to offend anyone. It's just to get that message across, just like truth.org put their smoking ads out and have someone smoking out of their stoma or whatever the case may be. No difference. We got to get a handle on kidney disease. So with that being said, I'd like to bring on our guest who is no stranger to kidney disease. She's been on dialysis. She's a staunch advocate of kidney dialysis in-center advocacy because she knows the injustices that goes on in these clinics all across the country. It may not happen in your clinic, but it's happening. But we have a transplant warrior who did dialysis, went through that journey, type 1 diabetes, right? Now she has her own foundation helping other warriors trying to find that gift of life. So without further ado, I'd like to bring on all the way from Connecticut. I'm not sure if it's Hartford, Stamford, but it's in Connecticut, right close to the New York line, Jen Benson. I got to give her the definite VIP welcome, and then she's going to introduce Remy, the person she's advocating for, and he's going to tell you about his journey with kidney disease. And you may be surprised, this gentleman, as I said, kidney disease just don't affect minorities. It affects everybody. However, minorities are affected at a disproportionate rate. So we got a guy here from France that has kidney disease. So it's no stranger. So without further ado, let me bring on Jen Benson. Jen Benson, what's going on? Finally.
Yes, Steve, thank you so much for having me, and thank you for letting me bring Remy on and be a part of this whole show. This is fantastic. I really appreciate it.
Oh, absolutely. Thanks for coming on. I mean, when I saw you on Warriors Quest with Tiffany Joseph, yes, I said I knew I had to have you on. You're a staunch advocate for kidney disease, not just transplant, but kidney disease as a whole.
Absolutely.
Yes. So introduce your mentee or the person that you're advocating for. Tell us about him before we bring him on.
Absolutely. Remy and I were paired up about 3 months ago, I would say, by someone that I volunteer with. She's a living donor, and she donated her kidney about 3 years ago to someone that was going through dialysis herself out in Minnesota. And she had been going through a struggle for years and years and years while she was attending university out in Minnesota. And she kind of kept it all to herself, the struggle that she was going through. She didn't want many people to know. She stuck to it very quietly. She didn't want people to know. I don't know if it was because she was embarrassed or just kind of wanted to go through this battle herself. She was a quiet warrior. And when this mutual friend of Remy and myself found out about it, she kind of knew deep down that she would be the one to save this young girl's life. And this mutual friend that I'm talking about is Chelsea Larson. She and I volunteer together. And Chelsea kind of reached out to me and said, Jen, I think you might be able to help Remy because of what you've been through yourself. And I had started the transplant journey about a year ago. So Remy and I connected. And since then, Remy and I have been working together to kind of create a campaign for him to find a living donor. I created the transplant journey because of the battle that I've been through myself. I spent 7 years on dialysis. I did both in-center hemodialysis and also home dialysis. I was also trained in PD. However, I never actually qualified to do peritoneal dialysis because my blood pressure was just absolutely out of control. And the day I was wheeled in to have the catheter placed, it was absolutely way too high, and the anesthesiologist wouldn't clear me for the surgery. I've also been a type 1 diabetic for over 25 years, and my blood sugar was too high. So they just thought the risks were too high, and I was never approved for that surgery.
Gotcha.
So because of that, I was forced to do in-center hemodialysis. I was the youngest patient in the center. And after about 4.5 years of in-center dialysis, mentally, I couldn't take it anymore. So at that point, the center recommended perhaps I look into home hemodialysis. And
Wow.
so I did that for about 1.5 years. And due to issues with clotting at home, it just became too dangerous. And because of other risks that were involved with the line, I finally was forced to go back to in-center dialysis.
Wow.
And finally, while I was having a treatment in-center, that was when I finally got the call and the offer after 13 offers. That was finally my miracle call. And I had my transplant at Columbia New York Presbyterian Hospital.
That's awesome.
Yep.
Awesome. So let us bring on Remy. Where is he from? Tell us a little bit about him.
Remy is from Philadelphia, Pennsylvania, and he's currently listed at UPenn. And as you guys can probably see down at the bottom, it's going to scroll. Remy is listed at UPenn. And the number is going to run at the bottom of the screen. So anyone who's interested in possibly getting tested to be a prospective donor for him. Remy and I have also worked to create a website for him. So if people want to check out his website, that's going to be listed down at the bottom as well. Or if you want to find out more information, you can look at my website as well. You can contact me directly and we can find out more information. Or if anyone would like to share Remy's story, we're going to bring Remy on to talk about it. Remy's fought a long, hard battle with PKD, which runs in his family. Remy's dad also had PKD, which is a genetic disease, and it affects the kidneys. Unfortunately, it is a genetic disorder and runs rampant in the United States. There is no real cure for PKD, unfortunately.
All right, let's bring Remy on. Let's give him the VIP treatment. All right, here we go. Uh-oh, we missed him. Hey, Remy, how you doing? There we go. How's it going?
Good evening, Steve. Thank you so much for having me. Hello, Jen. Nice to see you again.
Thanks for coming on. Now, Remy, are you on dialysis right now?
2 days left. Tuesday, I'm getting my catheter, and soon after I will be on dialysis. So it's been a long journey, and it's coming right to the wire. I've known for 30 years now that my kidneys are failing. I stayed away from processed food. I stayed away from soft drink. I stayed away from everything I could. Over the last 2 years, it's been basically rice and vegetable, completely vegetarian. So I've been able to really push it further, push it back, but that's it. 2 more days of freedom. So
Right. So what is your GFR right now? Are you experiencing any signs and symptoms that require you to do this immediately?
yeah, I'm at 12 of GFR. So GFR, for people that don't know, is your kidney function. Most of us has 100. I'm about 12% of kidney function. So I have what is called uremia. So it's blood poisoning. I have urine in my blood. My memory is shrinking. My mood is evolving. So I've been postponing. I wanted to enjoy some of the best days of the summer, but I've been pushing it way past, and so today is the day. So
Right. Um, can you share with us how you prepared for this moment?
it's impossible to prepare. So in many ways, you know, this has been driving my life because I know it I've seen my father when I was 15 going on dialysis, doing it at home. And then he went on getting a transplant for 10 years. I was diagnosed when I was 21, 22. So in many ways, it gave me my strength to run my life differently, to run my life with a purpose. But you never prepared for that. And actually, Jen has been monumental because I would tell you very few people know that, I'm at the end of the rope and going on dialysis. And she's really helped me to share her story, helped me realize that it's okay to come out, that I needed to share it. And it made a world of difference because the reaction for many people, I've seen it in my father, I think Jen talked about it, or a friend. Initially, you keep it for yourself, and you chew on it, and so coming out with the news is actually in some way liberating, but it's going to be a big change in my life. I'm going to be hooked up to a machine for 5 years, 10 years.
Oh, well, no. I wouldn't say that. I wouldn't. You don't never know what can happen. And I sincerely mean that. Just like I know you can't compare the two, but just like a death row inmate get that pardon, that last minute call from the governor, you just never know, Remy. I've seen people come on the show and a week later get that call. We don't know what the future is. We just know what today is. We can't project in the future. So please, I know that's what research and that's what society says, 5 to 10 years. And I think a lot of people gravitate to those numbers instead of maybe believing and trusting in their faith and just letting it unfold that way.
But that's actually, go ahead, sorry, Jen.
No, I was going to say, I think that's why we really need to get the awareness out there. We need to look to people here to share the story, and we need to look to people to be willing to go out and be tested as prospective donors and ask friends and family to share this show and publicize it and spread the awareness to others. And once they hear the story, spread it and educate each other on health and really publicize this,
In many ways, what I realize is we are in this together. Giving organ is a very big step, but there is need for blood donation. There is not enough blood right now. As of August 29, plasma, COVID-19 plasma is an approved treatment from FDA for treating COVID-19. You have 4 million people that recovered for COVID-19, 6 million people that actually have COVID-19. 1,000 people die every day from COVID-19. Go and donate your plasma. Go and donate your bone marrow. Bone marrow waiting list is 3 weeks.
Right.
When you have cancer, this is eternity. And it's like an hour procedure and it transforms somebody's life. So I think the giving a kidney is a big step, but I think many people, we think always there is a pill, there is a vaccine, actually we are in it together. And if we were to share, and the probability that you will need blood transfusion or bone marrow is actually pretty high. So the only way it works is if we all contribute and all share together. And this is a miracle of life.
Sure.
There is only actually, I think, 3 deceased donor per 1,000 deceased donor that actually could donate the organ because of the condition of death and whatever. So it's really relying on generosity, making the gift of life, for the good of everybody.
Sure. Jan, let me just say something, then I want to ask you a question, Jan. What I want to say, Remy, you mentioned about plasma, and it's very ironic that you mentioned that. And the reason why I say that is because I do advocacy for kidney disease, and I know in Texas, Baltimore, and a lot of urban places, they have these plasma centers set up next to a dialysis center. And a lot of times, these plasma places only pay maybe $20 to $40 for the plasma and then resell it for thousands of dollars. Now, I agree with plasma donations, but they need to step it up with paying people to get that plasma and reselling it to make a profit off of it, because they're basing it off the needs of those people. They know they need the money. So if they can just get their plasma, you get $40. People doing this every day, standing in line outside the doors just to make a living, and they're not getting anything over $100.
It's saving life.
Yeah, but Jen, what I wanted to ask you, so we have Remy here tonight.
Yep.
Okay. Last week you had Tiffany Joseph on Warriors Quest.
Yep.
Warriors Quest has a person seeking a kidney every week.
Yep.
Now, with everybody in this kind of like bubble community, Donna Tissot is advocating for people. Jared Brown, Jeffrey Brown. Now, if they're advocating, y'all advocating, it's in the same community. How does this distinguish far as how does a person who sees this that want to be a potential donor, how do they weed through all these people that need a kidney to decide which one they want to give a kidney to?
That's an excellent question. You have to be a person that stands out amongst the masses. For some reason, each patient is going to have a pull with a person. It's going to be your story that is going to stand out to a prospective donor. It's going to be your face. It's going to be something that you do that's going to be very individualistic. Is it going to be maybe your pet that pulls someone in? Is it going to be the fact that you garden? Is it going to be the fact that you knit? Is it going to be the fact that you belong to the Kiwanis Club and maybe that person that read your story belonged to the Kiwanis Club? Is it going to be the fact that, hey, we both went to Disney World that same year and we rode that ride that pulled me in, and that's why I want to donate? Is it going to be the fact that we were both young grandparents that had the appeal that pulled me in? Is it going to be the fact that I had a magnet on my car and we were both driving on the same highway that day and that happened to pull me that day and that got my attention? Is it going to be that morning I was reading the newspaper, having my cup of coffee, and I had the calling? That could be it. There are a million different reasons. I know, for example.
I'm sorry to interrupt. I in my mind, I had a question, I forgot, and it came back, and I don't want to forget it.
Yep.
But let me ask you, with transplant, are we getting back to like a God committee type situation with transplant, to where if somebody wants to donate, it depends on these other factors that you just named to decide whether they want to give it to a mother of three or a grandmother or someone like Remy or this person. With so many organs that's needed, do you think we're kind of getting back to a type of quote committee type of process for who gets a transplant and who don't, based on certain attributes and qualities of their lives?
That's an interesting question, because back in the day, when dialysis was first invented, dialysis took a lot of heat because it was sort of deemed as a God committee then, because there were so few dialysis machines when it was first invented that they almost played God, because they chose what patients were allowed to receive dialysis. And nowadays, with transplant patients, it's the centers that really do such a screening on the donors. They go through such a difficult evaluation process in terms of, there are many donors that say, after they go through the screening process in terms of the health evaluation, that they will say, that was the best exam I've ever received in my entire life. The scans that the complete body goes through, all the way down through the psych evaluations that they receive, to make sure they will pass all the tests. I don't think they're really playing God, but they want to make sure they're in the best physical condition, because these people are truly selfless heroes and giving of themselves to save someone else's life. I don't think you can say that these doctors and these centers are playing God. They just don't want to put anyone in harm's way. So I don't think they're playing God. But these donors are literally just they want to kind of choose someone that they connect with by reading these stories when they're picking someone. I think it's a natural bonding that they're doing when they're picking someone, because they are literally picking a complete stranger. So I don't think it's just human connection, I think, is what they're doing.
I'm sorry, I had my mic off.
Yeah, I was just gonna say I can't hear you.
So Remy, you have polycystic kidney disease, correct?
Yes, sir. Yeah.
Now, do you have any siblings or relatives that try to donate that you reached out to?
I have two sisters. My older sister is also has PKD. My younger doesn't have PKD. She may be a donor at some point, but she still has young kids. She's divorced. She's alone at home. She's in France. So logistically, nothing in the coming 4 or 5 years until we are able to make something happen.
Sure. Now we have a host. Her name is Lisa Baxter, right?
Yeah.
And she comes on Sunday nights, Remy. Now, she had, and I hope I don't get this number wrong, but seven siblings, PKD. including herself. And she has a transplant. She was on dialysis 12 years, and she had a transplant now for 4. So just to let you know, I know you said your sibling had it, but just wanted to give you an example of someone who had 7 siblings with PKD. So, this thing is rampant. Now, Remy, when did you first know? I know you said you saw your dad going through this at 15. When did it start become a problem for you, and how did it pop up in your life where you needed to go seek medical attention?
Well, so, I was diagnosed when I was 21. They did an ultrasound, and so we knew it was running in the family. So I was diagnosed pretty quickly. The first sign was blood pressure. And so I've been on blood pressure medication for the last, 20 years.
Gotcha.
And then from there, it went from, 1 pill, 2, 3, 4, 5, and all kind of cocktail to try to manage the creatinine and all kind of side effects. And so it's been a progression. What was key for me, learning about it early and learning what are the implications of your lifestyle, was to make those critical change, exercising, but also very low sodium. So I stayed away from any processed food. I worked in the food industry. I was buying ingredients. I know what goes inside those processed food, and clearly I stayed away from any of that. And then over the last 4 or 5 years, really cut on any type of red protein, a bit of chicken, a little bit of fish, and over the last 18 months, it's been a completely vegetarian diet. And I'm doing great. You just have to adjust your taste bud, but you feel so much better. You see it when your kidney function is so low. I have if I have a sip of wine or 3 bites of beef, the next day it feels like it's the 2nd of January, and you party all night, and you feel like you're sick all day, and
right, wow, sluggish.
Yeah.
You see it, you feel it.
Yeah.
So for anybody out there, stay away from the sugary drink, the processed food.
Talk about it.
Natural. It has a big impact.
Yeah.
My dad went on dialysis when he was 42. I basically pushed it 10 years, basically managing my lifestyle.
So Remy, let me ask you, by you having PKD, have you seeked out, or before it got to this point, about any drug trials to delay the progression of the cyst and the disease?
So I would tell you that some of our best friends in the families are doctors, dialysis nurses, going way back. My mom was very active in the PKD Foundation back in France.
Wow.
And so probably 15 years ago, I was doing research, and I found that the Mayo Clinic was launching tolvaptan. I may have misspelled the name. And so I was living in New Jersey, and I called the head of the Presbyterian Hospital, the head of nephrology. I said, this is a new drug, your leading hospital, you need to run a clinical trial. And I was like, who are you? I'm a patient. I'm your number one guinea pig. So he called me back, 4 months later, and he said, well, we're starting. We're doing it. And so I started the process, and I was actually out within 2 weeks. There was a miss in the protocol, and I couldn't get on the drug. So I had to wait for phase 2 4 or 5 years later.
Oh my God.
A little bit, and so
Wow.
But I was
Very
happy to
interesting.
start, and hopefully some other people, you know. But there are a couple of drugs. It doesn't cure. It's not a cure. It's
Right.
only turned on, and the side effects are also pretty significant. I mean, you drink 2 gallons of water a day. When you have a rush to pee, I mean, you wouldn't leave your house anymore. I mean, so there is some pretty significant side effect to the drug.
Now, Remy, have you decided what treatment option is best for you at this point?
So I'm going to do home dialysis. I'm going to do a peritoneal dialysis
Awesome.
probably with one or couple of transfer.
That's awesome.
So I've seen my dad doing the hemodialysis. I think it is more involved. The peritoneal dialysis, at least initially, should be. So while setting up the bedroom upstairs, I've watched a couple of videos trying to get in a routine, and mentally getting ready to plug myself every night.
Sure. Now, let me ask you one more question, Remy. Well, I got more questions, but I want to ask Jen a couple questions. Before Jen came into your life, what were you doing to advocate for yourself or to deal with this disease in your own? What were you doing before you met Jen to tackle this disease?
A lot of this, a lot of thinking about it, but I never came out. This is first time I'm going, pretty much.
Sure.
A couple of people in my family knows about it, 2 or 3 friends. But I created the website, a couple of...
yes, we see it down here scrolling across.
I've been doing a lot of search engine optimization, trying to publicize and get some contacts. So I'm getting some. I've been able to help to connect to a donor that wanted to donate for a kid. So I'm getting questions every week from people that are going to be on dialysis, and so I've not found my lucky one, but it has helped me to answer people's questions and help people along. So
that's awesome. That is so awesome.
To say you need to come out, you need to have a plan, you need to. It is okay. We've been there. Look at me. We go on the other side, and that's when you're on your own in that journey. It's you chew on it and you close yourself.
Yes.
And
yes.
And really, she's my hero. So every day, every week, she's like, well, let's do this. Let's put a speaker on the back of your car. Let's go. You have to meet Steve.
Yeah. Oh, absolutely. You never know.
And it's actually liberating, and it's actually empowering. And I feel great actually now if I can help somebody else with my learning and my journey, and so that has been amazing.
Okay. Now, Jen, let me ask you, how could a pair donation, like if you had a kidney warrior that was somewhere else that was looking for a kidney as well, is there a thing to where maybe a bunch of warriors could get in a group to where they could all at the same time seek a shared pair donation where maybe it can help everyone in that group? Is anything possible like that to promote better organ donation through the shared pair, where maybe not just one person? I mean, I know we had these multiple chains at Johns Hopkins and other places, but I mean, is there maybe a way to where strategic, like say for instance, like you may be advocating for 4 or 5 people,
Mhm.
Is there, and maybe one of them may have somebody to do shared pet or whatever, or someone they could donate but can't donate to them. Could you actually like say, hey, we can form a group where maybe that person can do this and then they can come and help you? Is that even possible?
So that would be like what would be like a advanced donation or what's called a standard voucher. So if they wanted, what would happen is they could donate at the moment. And let's say the person was sick. Let's say the person they wanted to donate in that moment, the recipient was sick, but we were scared to say lose the donor. So what would happen is that donor would donate in that moment and they would receive a voucher. So that recipient would receive the kidney in due time and the recipient wouldn't lose that donor. And when that recipient was well and healthy, they would receive that kidney. So later on, 3-4 months down the road, they would still receive that donor. And what would happen is a chain would occur and it would continue along the line. So multiple people would then benefit from that one person starting that chain. And the National Kidney Registry, the NKR, is responsible for that. So I often recommend that people look into the NKR. They're phenomenal in facilitating a lot of these chains and advanced donations or standard vouchers to create massive chains that occur in that situation. That's where I refer to a lot of patients. They look into that. And they have a lot of hospitals that participate in these situations. So that's where I refer to a lot of patients that look into that.
Now, I can't even remember the names, but we've had many people on our broadcast, transplant recipients, and started, organization, nonprofit.
Yep.
What's different about yours from any other organization out there that promotes transplant advocacy? Because we know everybody has their own way of advocating for someone, but what separates Transplant Journey from any other organization out there?
Another good question. Basically, I feel as though kind of what separates mine is I have based mine on, I was thrown into this from day one. I had no background, no training. I walked into this and people expected me to have the knowledge of everything. Well, you should know about transplant. You should know about dialysis. I had no support system except my family. And I went through torment. I went through hell. And, I came out a survivor on the end with a wealth of knowledge based on my own experience. And I am trying to grow this based on this. Right now, my focus is on kidney and pancreas. And I now have 11 volunteers, all based on their experience in all areas of organ transplant.
Wow.
And I am looking to basically, grow this as best I can. I am looking for other volunteers who feel they can spread their wealth of knowledge based on their experience in transplant as well. I don't charge for this. And literally, I would like to slowly help spread awareness through all organs. And that's all I can say. I would like to blow this out of the water. I question every day why there is such little information out there on kidney disease when it is, under the top 10 killers in the United States. I look at this and there are 114,000 people waiting for life-saving organ transplants. over 94,000 are waiting for kidney transplants.
You know what? I think it's a little more than that.
It is. Those
That
stats
sounds like
are
a standard number from years.
Those stats are from 2018. They haven't changed them since 2018, but it boggles my mind. It really does.
Yeah.
And I can't get away from it. I used to get so angry watching TV in dialysis, and I would see ads for cancer. I would see ads for AIDS and all these numbers, and we have all these services to help you. And I would say, where are the ads for dialysis centers? Where are the ads
Me too.
for kidney disease? And it just gets swept under the rug. And I would feel my blood pressure rising. And no one would be able to answer these questions for me. And I can give you this number right here because I have this written down because it would just absolutely infuriate me. In 2018, $114 billion was spent on chronic kidney disease treatments.
From Medicare.
Yes.
114 billion?
Billion, yes.
Oh, you know what? And they exceeded over, I guess, 50 billion because back when I was doing my my master's and kind of doing my research, they said by 2020 it would reach 50 billion, but it seemed like it doubled that. That is ridiculous.
And more dialysis centers are being built on every street corner, and we're literally doing nothing to eradicate this problem.
Talk about it. Where my I got to put my my petition up there. You talking about the escalation of dialysis clinics? Go to thechange.org, educate the community, and sign the petition to have these clinics or these corporations put more advertisement and awareness out in the community through billboards, advertisement, print ads.
Yep.
But yeah, they're building the communities and not even educating the same community that they're slipping these clinics in.
Right.
So guys, go there. If you're watching, go to change.org/educate the community and sign the petition for me. Once I get 5,000, I'm at 3,390. Once I get 5,000, I'm going to hold a press conference in front of the DaVita in Baltimore and talk about it. Yeah, I'm going big time.
We'll print the t-shirts.
Yeah. No, because this is serious.
Yeah.
And like you said, it's part of the top 10. I mean, no disrespect to cancer survivors out there, but it's more than HIV or people that die from AIDS, breast cancer, prostate cancer.
Exactly.
And again, the 9th leading cause of death. We not in Nepal. It's the top third. It's the third leading cause of death from glomerulonephritis.
Yes.
Can you believe that, Remy? In Nepal, the leading cause of kidney failure and disease is glomerulonephritis.
Wow.
Right.
And here it's diabetes and hypertension.
9 out of 10 people don't even know they have it that are walking around in the United States.
Yeah, that's crazy. So it just adds more to the list. So Remy, let me ask you, are you a tall gentleman? Because it seemed like, and the reason why I asked, because a lot of people that I met that had CKD were kind of tall, and so their kidneys kind of grew inside or increased in size that caused significant pain. Are you having that issue with pain from the cyst?
So, not too much pain on a regular basis. Sometimes pain in my back if I work or exercise or do physical activity too much. But I started to have more regularly now cyst bursting. And when cyst burst, within 15 minutes, you're on the floor and it's excruciating. So
wow.
medication with me at all time, and I self-medicate, and I just go down in the bed and for 24, 36 hours and let it go. But the kidneys now, usually they're about the size of your fist. Mine are probably that big, and so your stomach actually starting to protrude.
Yeah.
So it's pushing up on my
diaphragm.
Intestine. I cannot have a full meal anymore. Everything is.
Wow. So, guys, that's why we have to advocate, as Jen said, with kidney disease, whether it's PKD or any one of the other genetic FSGS, diabetes, hypertension. Kidney disease is kidney disease, no matter how you get it. So now, Remy, have you been trained in peritoneal yet?
No, not yet.
Mm-hmm.
And that's a relatively short training process compared to the home hemodialysis, which is very difficult and requires a partner to be present at all times. Which is why, a lot of people prefer the peritoneal dialysis.
Someone was saying that Medicare waived that caregiver for the home hemo. Have you heard that? Yeah. Because I know somebody who do it home alone down in Florida.
Oh, wow.
Yeah, so check that out. As far as the Medicare, they waived that. So, okay. I don't know. I'm just, just speaking.
Maybe it varies state to state. That could be something as well.
That's true. But yeah, because I know they wouldn't train a person to go home if
it was dangerous.
Yeah. Wow. So Jen, how many people you advocate for other than Remy?
Currently I'm working with 11 people.
11 people.
Yeah.
So just take us through a daily routine that you would do for. Okay, somebody reached out to you right now and said, Jen, I want you to work with me. I'm listed at Sand Hill Hospital.
Yep.
Take us through the steps on what you would do once you get that phone call asking for assistance.
Okay. So a typical phone call kind of consists of asking them what they've been told by their doctor, if they've started dialysis, if they have started dialysis, or if they haven't started dialysis, what type of modality they've selected. And if they have not selected a modality, I ask them what their lifestyle consists of. Are they working? Are they not working? And if they have not already chosen the modality of dialysis, I'll kind of present what dialysis choices they have, and I'll just let them know what is out there. And then if they have already picked their dialysis, fine, we don't go into that. Then I'll talk to them about dialysis centers, fine. We'll go over their dialysis centers. Then we'll talk about transplant centers. Are they currently multi-listed, and the benefits of multi-listing, if they're curious, if they're interested in multi-listing, or if they just want to be listed at one center. I'll talk about why they should be listed at multiple centers. Then if they are curious about listing at multiple centers, I'll usually map out centers that are drivable. And if they're curious about going to multiple centers, then the benefits of doing that. If they have the financial means to fly, or if they want to only do trainable access with trains, we'll go with that. About their nephrologist, do they feel comfortable with nephrologist? We'll talk about questions they should be asking their nephrologist. We map out a plan about getting to know their coordinators. We'll talk about things to pack for the transplant centers, the benefits of all that. I have a whole guide that we can go over, picking and choosing diets, questions they should be asking their centers. Are their centers, do they participate in steroid-free regimens? We'll talk about things in the sense of things they should know about after their transplant. Literally, there's an entire program that we can work with, an A through Z guide, basically, of transplant.
Mm-hmm. So have you had a success story?
Yes, I've got about 3.
Wow.
Mm-hmm. Mm-hmm.
Can you share one of them?
One of them is a friend who I've become very close with, who actually was only in the beginning going to get a kidney transplant. And she was listed at a center here in New York. And she was also a diabetic like myself. And after working with her, she actually was a diabetic as well. They never even suggested to her she look into a pancreas transplant. And she ended up having a kidney and pancreas transplant and is now free of her diabetes and had a kidney and pancreas transplant like myself, and is now completely off insulin, and had her transplant at the same Columbia New York Presbyterian like I did, and actually had her transplant performed by the same surgeon like I did.
Wow.
Yeah.
Now, do you work with people across the United States?
I do. Mm-hmm.
Wow. Okay. Remy, when you tell people you have kidney disease or kidney failure, do they say you don't look like it? Have you heard that before?
Yeah, not as much the last couple of weeks because I lost weight, I'm pale, I don't look normal, but otherwise, yeah, from the outside, you're still looking about normal. And so that's, when you're starting to unpack your story and people ask you, how are you? Okay. It's like, yeah, you're doing good. So it takes a little bit more to unpack the story. And that's one of the things that Jen actually, outside of the, planning the before, during, after strategy, transplant center and everything, she's really helping you to engage with people on the personal level and tell your story. Because before, it's your story. I don't know if it is the same with people with other medical condition, but this one being long and the fact you still look okay from the outside, you don't share the story. So you go to party, but you arrive late, so you can miss dinner. And then you pick on the tomatoes and the carrots, and you have a glass of water and not wine because you again on antibiotic, or so you come up with stories and you just slowly close your story, and so you don't come out. So I'm learning to share the story with people and whoever is willing to hear the story. And Jen has been instrumental in telling me that it is okay, and so so that's actually, it's a big, she's my hero because I'm seriously, she's sometimes she's pulling me, sometimes she's kicking my butt, and she's she told me a month ago and said maybe one day we'll go on Facebook, and I was like, Jen, Facebook, my family doesn't know I have this condition. How do I go on Facebook? And so a month later, here I am. Yeah, so I'm slowly coming out, and I won't find a solution unless I am coming out and sharing my story, and so Jen has been absolutely instrumental in helping me there. You're on the mute, Steve.
I'm sorry. I got a phone call. I forgot to turn. But no, that's awesome that Jen was able to bring you out of that shell to share your story, because it may be God's way of sending somebody there just to give you that extra help to get you, over that hump. And now, Jen, we kind of at the end of the hour. I'm gonna stay on just for a couple of more minutes.
Mhm.
But what would you tell people who are maybe watching this broadcast that, let's say they just got on dialysis, they got hit with the kidney failure, they never knew the information like Remy or some other people, they just got kind of thrown into it, and maybe they're on their third, fourth month, fifth month doing dialysis, and they may be watching this broadcast. What would you say to those people, and they never even heard about the transplant or anything like that? What would you say to these new people that's getting on dialysis that may be watching the show right now?
First thing I would say is you're not alone. I know it's a scary, scary, dark place, and we've all been there. The best thing you can do is arm yourself with as much knowledge as you can find. Please reach out to the Transplant Journey. We have people and mentors that will help you. As much research as you can find, reach out to us. We will help you. There are others that will help you. While you are sitting in the chair at dialysis, when you feel healthy enough, look online for information. That is the best thing you can do. Reach to fellow kidney warriors. They will help you. It seems like you are alone. You are not alone. The community out there will support you. Please tune in and watch Steve's show, watch Jared's show. Look to people out there. They will help you. The best thing you can do is knowledge will empower you. Do not be scared. Again, reach out to the Transplant Journey. We can help you. We will arm you with information. Literally look to others. You are not alone. Awareness is education.
Oh, absolutely. I agree with you 100%. Remy, what do you want people to know about PKD and your journey and your plea for a kidney?
Well, it's I never grew up knowing to ask. I've always grew up to, be independent, care for myself. But this one, I'm not going to be able to do it on my own. So somebody out there can change my life. I think I can help them as well along the way. I can impact their life, also in a good way. We're in this together. It's not just about kidney, or not just about me. It's about contributing and taking care of each other. As I said, it's about blood donation. It's about plasma. It's about bone marrow. It's about organs. We are all in this together. And if you watch this video and you think you can help, please call the number below, the 215-662-6200, and tell them that you're looking to help Remy. Thank you.
Absolutely. Remy, one thing I didn't get, and I don't know if you sent it to me, Jen.
Mm-hmm.
What is your blood type? What type of donor you're looking for?
O positive. So I am a universal donor, but I can only receive from blood type O. but through pair matching,
Right.
even if I get another donor, we can create a chain.
Exactly.
And we can make
Right.
it. So,
Jen, how common is that? The blood
Very-
type that people
Very common.
owe, and is that what's holding up for a lot of transplants?
Mm-hmm. O is the most common. I really don't like to put the blood type on because it doesn't matter. As long as you have a donor, it doesn't matter. That's the most important thing. That's why I don't like to put the blood type down.
Wow.
I'm actually very against putting a blood type down because it turns a lot of people off, because immediately they say, oh, that's not my blood type. And they don't want to then.
Oh, sorry about that. I'm new to the whole transplant, but I just noticed that he had the information with no blood type. But
that's okay.
That's okay. Wow. I mean, that's how you work. I mean, if that works for you, stick with it. Absolutely.
Mm-hmm. That's fine. No, it's fine. It's fine. I just, a lot of people think, oh, well, I'm be positive. So then I can't do it. So as long as you have someone step forward who's willing to get tested, that's all that matters, because then we can create a chain and move it along forward from that. Because the medications that exist now, we don't have to worry about being an exact match with blood.
Very interesting. Thank you for clearing that up.
Absolutely.
That's awesome.
Absolutely.
I didn't know that.
Yeah.
Wow.
Absolutely. Of course. Yep.
Very interesting. So, wow. Now, Jen, if somebody wanted to do what you do, what would you suggest? Is this something that only very few can get into? But we got a lot of people out here that has transplant that want to give back. Is this something that they got to feel to do and not try to create something that might not be them because they see somebody else doing it?
Who are crazy enough like me to start something like this?
But what would you suggest if somebody wanted to help other people try to get transplants and do what you're doing? What would be your advice?
You know what? There are a lot of organizations out there that exist. You have to have a lot of drive, you have to have a lot of passion, and you have to have a lot of time to be willing to commit to something like this. And you have to have a lot of determination, and you have to have a lot of experience under your belt. And I will tell you this, it's like a 23-hour-a-day job to do this. But if you have it in your heart, I think you go for it. Absolutely.
Wow. Awesome. So Remy, before we go, anybody want to say hello to?
All my friends out there, maybe the one also in France that are trying to translate and think about what's going on. So and so I will distribute this video to my Facebook friend and family and so on. So I'm sure they will recognize, and they may be surprised a little bit about the story of all the unpacking. And I'm sure I'm going to receive a couple of phone calls and people asking me how I'm doing and what's happening.
Jen, let me ask you. Could Remy get transplanted in France if somebody from France stepped up? How would that work? International transplant.
International transplant, I'm not so certain about that. We could have people from France be willing to step forward. It would all be about obtaining visas to have them come over here to donate.
And they will have to stay in the US for 2 months following the transplant. So logistically, it's possible, but it's not easy. It takes a little bit of organization.
But also, Steve, just to mention for people that don't know, Remy's insurance would cover the cost for all prospective donors who would be willing to step up to the plate for Remy. So
Awesome.
it would cover it. They would incur zero costs if they wanted to save his life.
That's awesome. That's good to know that. That's good to know that. Now, Remy, would you be willing maybe to come back maybe in a month or so once you get acclimated with peritoneal and share your journey just with peritoneal? Because we do a home dialysis show as well. And just to let other warriors see how you transition from this to PD and how it's more beneficial and having you able to spend more time with yourself, family, friends, and not have to go into a outpatient hemodialysis center.
Absolutely. Anything I can do to help, educate, share my story. And I say, I think we're really in this together. This affects so many people, much more than people think. The issue is that many disease, you realize that you are affected from early on in the disease. With kidney disease, you start to realize you have an issue when it's too late.
Yes.
And so it's a time bomb. It's really a time bomb. I was lucky because I learned from it from my father, and I've been managing it, and I've been able to postpone it. But most people, Jen, it happened to you in matter of, sometimes it's hours, days, week. It's just coming on you. You go to the doctor, you don't feel good. They do a blood test, and you say, sorry, next week you're on dialysis.
You're right.
Or I say, what is happening to me? And so we really have to educate people about eating differently, about taking care of themselves, and also the fact that when they do, they can postpone the issue, and the fact also that you live very well with one single kidney. I have 10% kidney function, and I live about still a decent life. With one kidney out of two, actually, your kidney function go back to about 60%. You live absolutely a normal life. So a solution is out there, a solution to prevent, postpone, delay, educate, but also a solution for the unlucky one to really, I'm 52 years old. I'm waking up every day and building a better tomorrow. I'm not ready to give it up yet. So
that's awesome.
Yeah, for sure.
Wow. Guys, I really want to thank you. This has been an awesome show, Jen, and definitely want to bring you back with maybe another one of your mentees that you're working with.
Absolutely.
And like to follow up with Remy to hear his story with PD. And one question I just want to ask before we go, Remy, is kidney disease prevalent in France?
Probably not as much as in the US, because we tend to manage a diet better and stay away from processed food and salty food and so on. But it is also increasing. It is increasing also very, very quickly in India. It is so. It's really a problem everywhere in the world.
Absolutely. Yep. Absolutely. Well, Jen, man, this has been a great interview. I enjoy having Remy on, and Remy, I'm not sure if you're on Facebook, but if you are, please send me a friend request, or Jen, send me access so we can share his information,
of course,
on our page, and do what we do, just to help spread that information, and maybe talk with Jared to get him on Warriors Quest.
Great idea.
At a later date, because that's what this is about, just trying to network and help everyone. it's almost like everyone's in the same pot. So we just try to get it out there. You never know what may come out of that. And like you said, I really like the answer you told me about how you decide, or how the person's going to decide who they're going to get a kidney to out of a pool of 10, 20 people, and if somebody want to donate. Like, for instance, somebody see this show or see the Warriors Quest show, and they a potential donor, and it's like, I want to donate, but I just don't know who to donate to. How would they come to that decision? Because then you have people reaching out to them, writing letters, and trying to appeal to get that person. So I don't know if I would want to be in that position. You know, I would have to do it anonymously. Make the decision and then do it that way, but not say who I'm going to give it to, because I wouldn't want any type of, ill will feeling. It's just unfortunate that it has to be like that. So anything we can do to help, transplantjourney.org, to get the word out, anything we can do to help Remy or any one of your 10 other people that you're advocating for.
Thank you, Steve.
We're here to help and assist and do anything we can to get the message out. And I mean that.
And vice versa, obviously, vice versa.
Yeah, because we got to come together as a community. We got these small, different organizations out there doing everything the way they do, and that's rightfully so. But at some point, we got to use each other. Yeah, we got to kind of interlock to use each other to help people. Like, if I can't do something, I'll refer them to you. If you can't help someone, you refer them to somebody who may can help. I mean, that's how it should work in this community.
Yeah, absolutely. 100%.
So again, Jen, thank you so much for coming on. Jen Benson, founder, CEO of TransplantJourney.org. Remy, we really appreciate you, and please send me a friend request, Remy, so I can get access to your information and anything that we can do to help you. I'm just looking around, but just a quick thing. I was a dialysis nurse for 33 years, so I have information on peritoneal, about the machine, anything that you need to learn. I mean, outside of what you learn from where you're going to get your training from, we're able to also just connect you with other warriors who know about PD, that's been doing a long time. They can kind of give you tips, and that can help you manage and navigate through this process outside of your training, because they only do it, and you got the 24-hour number. But if you may have a question, say 10, 11 o'clock at night, there's not an emergency, but just a burning question, you got people you can reach out to ask that question. So I just want to let you know we're here for you. Just like, share, follow us. If you need to ask a question, hit me up on Messenger. And if I can't answer it, I got no physicians that I could reach out to and nurse practitioners that could answer that question for me.
Thank you.
Steve, thank you so much for that offer. That means a lot. Thank you so much.
No, absolutely.
And thank you for having us.
Yeah, because I can understand, far as Remy's point of view, and getting hit with this and not knowing people, and then you coming into his life and him not having maybe the understanding or the resource to like where I'm going to turn to try to find someone who's going to donate a kidney to me outside of being on hospital or university pen transplant list, but they tell you it's going to be a certain weight. I mean, you don't have that time. I mean, we do, but you don't want to wait 6-7 years when you can be working right now to find a true stick donor or another non-living or living related donor. So anything we can do, I mean that, anything we can do to help, please reach out, Jen. You have my number.
Yep.
I have Remy's number. and so I'll lock it in, and we'll be connected. It's not just a one-time thing, like come on the show and see you later. Let's keep this going, advocate, and promote this, not just for Remy, but for everyone as well, and get their stories out as far as education, prevention, and awareness. So,
and if there is anything I can do to anybody in the group, anybody that's going through the same stage or have question, or feel free. You have my number.
Sure.
Share it. As I say, we are in together. So
absolutely. Thank you so much, Remy, for that. All right, Jen. Well, thank you guys for stopping in. And Jen, just reach out to me.
Okay.
I know I got Donna Tassat. She has some people that she's advocating for out of Florida. Yep. She hit me up while I was on. And so we're going to get to you, Donna. I promise you. I just got to ink in a date. And I know you say preferably during the week. So I do have all that. I got my plate a little full, but I want to make sure that happens within the next 2 weeks, Donna. I promise. But Jen, thank you so much. Let's keep in touch. I know we will. Remy, let's keep in touch. And God bless both of you. And thank you again for what you're doing, Jen. You're doing a great service.
Thank you so much, Steve. Thanks
all right, talk to you soon.
Thank you, Jen.
All right, take care, Remy. Bye-bye. Guys, this was an awesome show. I'm telling you, Jen is making moves. So if you're looking for a transplant and you're not sure where to turn, you got so many people to advocate for you. You got Jen Benson, you got Donna Tassat, you got Jared Brown, you got Jeffrey Brown. Who else out there? I mean, it's probably many more people out there that I'm not naming. I see some new names. S.J. Day. Thank you. I probably came with Jen, but thank you. Please like our page. Follow us at Urban Health Outreach Media, Urban Kidney Alliance. Tiffany, thank you for coming by. Bridget, I mean, so many people. Whoever joined, thank you guys. Everyone. I mean, I really, really appreciate it. And we're going to try to have more shows like this where the content and the quality of information is superb. I mean, it's been superb, I think, but just more variety, okay? A variety of information pertaining to kidney disease. So be on the lookout tomorrow. Tune in 9 o'clock for World Kidney News as we continue the Cooking with the Kidney Chef series, as we have on Chef Juvan, celebrity chef out of Florida. And he's not just a chef, but he's a kidney disease, he's a transplant warrior. I think 10, 15 years kidney transplant out of Miami, doing some great stuff. He migrated from New York, went down to Florida, opened up his own thing, cooking, and he's doing amazing work. And he's going to stop by tomorrow and cook up a nice dish, something with strawberries and greens. I don't know, but it's going to be out of this world. And I'm going to have Cassandra Floyd out of Arkansas, renal dietitian. You all know she's a transplant donor, donated to her sister. And so she knows a thing or two about the transplant diet as well as working with kidney patients. So tune in tomorrow night, and also Lisa Baxter at 8 o'clock. That's going to be a great show as well. So we see you guys tomorrow again. Thank you for joining. If you want to be on the show, please reach out to us, Messenger, Facebook, and say you want to be a guest, and we'll work you in to hear your story. Thank you guys for watching. God bless you, and have a great evening. Peace.